Lima kwanza unaendelea kugonga. Elon Musk amekaza pia huko. Na Trump naye akaamua rais.
Jadi
huyu jamaa alikuwa na huyu msichana.
Wewe mwanaume unaweza je kutegemea kondom za msaada?
Ndio nani anakuambia hizi kampuni ni moja, Elon Musk ndio ana supply kila kitu. Sasa gongeni bwana, gongeni. ARVs
hello,
haziwezi.
is anyone from model in? If there's anyone from model, please can you mute all of us? Okay, thank you. Someone has raised his hand. Can you just type whatever concern you have, please? Because you've been muted, so just type what you have. We are beginning in a minute. Okay, so we begin. Yeah, we begin now. I hope we received the second bit of notes. And we'll begin now with the looking at the history of sexually inherited diseases. So when you look through, okay, when you look through, what is important is for you to appreciate that STDs, or sexually transmitted diseases, or sexually transmitted infections, these are infections that are primarily passed through sexual contact. So it is primarily, but it does not mean they are only passed from one person to the other through sexual contact. Okay, but that is the main route of transmission. So of importance is for you just to note that we've had STDs since time immemorial. Okay, so when you look at as early as when we had some of the most ancient civilizations, we still had sexually transmitted infections at that time. The only difference between then and now is that now we understand more about what causes them. And once you know what causes a particular infection or a particular disease, when you understand whatever causes a particular disease, then it becomes easier for you to control it. So the main difference between now and during the very early times is that now we understand what causes most, if not all, of the sexually transmitted diseases. So initially, when people had these diseases, it was thought that it is a punishment maybe from God, from the gods, okay? Then with the time, it now became apparent that is actually caused by pathogens, okay? So we go to a level now where we had the identification of what causes syphilis, what causes gonorrhea. Then the very initial mode of treatment is they were giving mercury to people who are sick. So if they saw you portraying symptoms of having contracted syphilis or gonorrhea or any other, they will give you mercury in an attempt to treat. But what that did, it just led to poisoning, because that will lead most likely to organ failure. Okay, largely the liver, because it's the liver that deals with detoxification. So with time, it is only after the disease-causing microorganisms, whatever causes syphilis, whatever causes gonorrhea, it was after they were discovered that it was now possible to know how to control the STDs. The initial treatment came, the biggest breakthrough came when penicillin was discovered. So penicillin was given largely as the first attempt to control STIs that we've had since time immemorial. Okay. So later on, that is in the late 20th century, then we had HIV emerge. That is in the early 1980s. So when HIV emerged, okay, as a viral infection, and it began to attack the immune system, it led to a very big scare, because in some countries, especially the US, it mainly was thought to be a disease of the people who are engaged in gayism, so gays. But then it got to a level where everybody now realizes it's not just a disease of the gays, okay? So it's a disease that is attacking both people of either gender, and even if you are in a heterosexual relationship, you could still get that infection if you are not careful. So the initial days of HIV, they were riddled with a lot of worries. And it is at that time that now people began to bring in the idea of segregating people on the basis that if you have HIV, then we don't want anything to do with you, okay? But as more research and more knowledge about this virus came through, then we got to understand it more. So they eventually discovered what causes this disease. They eventually discovered its life cycle and some drugs that could control it. Okay, so when the ability to control the infection of HIV became known, then it actually became to be just like any other disease. So in the very early days, it was almost a death sentence. Okay, it was almost a death sentence. But now, after the development of proper control methods, then when the ART, the ARVs, when they were eventually manufactured and they began to work, then even if someone is infected with the HIV, as it is now, when you observe certain lifestyles, when you observe certain health practices, then you can end up living just a normal life like any other person. So among other STDs, apart from HIV, we have things like the herpes simplex virus, the human papilloma virus. So the herpes simplex virus causes genital herpes. Then the human papilloma virus causes the genital warts. Then you have some other fungal infections, the ones like the chlamydia, okay? The chlamydia, which is a fungal infection, which is also largely transmitted through sexual contact. So in the current 21st century, we've had immense advancements, and there are antibiotics, there are antiviral medications which have made it possible that you can manage not just HIV, but most, if not all, of the other STDs. Okay, so there is that ability that when you've contracted the disease, just a minute. So because of the advancements in treatment, because of the advancements in protection, you now can avoid being infected. But in the event that you are infected with most of these STDs, there are some, especially the ones which are caused by viruses and bacteria, most of them have treatment. The ones that don't have cure ni zenye zinakuwa caused na viruses. So like HIV, it doesn't have a cure, but you can only be treated. You can only be helped to manage, but you cannot be cured of it. Okay. So the main challenge with now the STDs that are emerging, we have aspects of drug resistance. So you have whatever causes a particular STD or an STI, it is now becoming resistant to the drug that was being used to treat it. So which then means that particular pathogen, that particular disease-causing microorganism can no longer be treated. So that leads now to need for further research. But most importantly is the current efforts within the public health sphere to raise awareness about these STDs. And one way is what we are doing now in this course, because we are just raising awareness that yes, we know most of you now are extremely sexually active. Even if we said you stop it, you won't. But we want to help you so that even if you continue doing it, you do it in a safe way. Because whenever there are people, there will always be relationships. Okay? Whenever there are people, there will always be relationships. And if most of these relationships are not done in under some guidelines, then they can easily end up now being harmful to the people who are relating. And that's exactly now what we want to help each other in this unit. So as we conclude, the history of STDs reflects a very complex interplay of medical knowledge, public health policies, societal attitudes, and scientific discovery. Okay, so from ancient times to the modern era, we've had STDs. They've been part of us. They've been part of the society because sex has been there all through. Okay, so because there has been sex, then infections that are transmitted through sex must have also been with humanity. The only difference is that then people didn't know those infections. So wangesema umerogwa, wangesema Mungu amekupatia laana. But with the scientific advancements, whatever causes these STDs got to a point where it was now discovered. So once it is discovered, then it is easier to prevent, it is easier to treat, it is easier to manage. Okay, and that is now what the age we are in currently, where now we know most of what causes STIs, STDs. So all we are doing is what can be treated and cured is treated and cured. What cannot be cured but just managed, it has to be done the same. Then what can be prevented should be dealt with as such. Okay. So let's now move on and now get into HIV as a virus. Then from this, we now link it up with AIDS. So HIV in full is a human immunodeficiency virus. These are viruses that attacks the human immune system. And in the immune system, it specifically attacks the CD4 cells. The CD4 cells are essential to help us to fight infections. But they are the ones which are targeted by the human immunodeficiency virus. So it's important for you to realize that this virus attacks humans. Kumaanisha ukiwa na, if you are HIV positive, then you do bestiality. Ng'ombe iwezi pata ukimwi. Okay? So it is just a human thing. But if HIV is not treated, then it can lead to AIDS. AIDS in full is acquired immunodeficiency syndrome. So AIDS is a condition where now the immune system becomes severely damaged. Remember, HIV is targeting cells that are helping us to fight infections. It's targeting the immune system. So if you don't treat the virus, it means that virus will keep attacking those CD4 cells even more. And the more it attacks them, it damages them to a level that now your body is exposed. And that's why you have people who are suffering from AIDS. Wanaanza kupata what we call now the opportunistic infections. So wanaanza kupata TB, ile ugonjwa yenye hawangepata kabla kuwa na hiyo ukimwi, saa hiyo wanakuwa nayo because the CD4 cells zimepunguka sana. Mbona zimepunguka? The virus has been attacking them within the body. So zinapunguka, then it gets to a level now where an infection which your body could fight initially, your body can no longer fight it. Ni kama kufikiria ukuje na uanze kupunguza wale the security people kwa gate yetu ya university hii. Okay, so kama wako 10 utoe mmoja, after 1 hour ukuje utoe mwingine, after another hour. So by the time it gets to around 3-4, if there were 10 people, there will be just 2 who are left. Okay. So the level of security that is being offered by 10, and you compare that level of security that is being offered by the 2 who are left, then by the time only 2 are left, the university is more vulnerable. Okay, so the level of security would have reduced drastically. Why? Because we constantly were targeting the watchmen. We were targeting people who are offering security. That is what HIV does. So when you have HIV, it's not automatic that you'll have AIDS. Okay, when you have HIV, it is not automatic that you'll have AIDS. But if HIV is left untreated, then it can progress into AIDS. So let's see a bit more about this virus that causes AIDS, now the HIV virus. So it is a retrovirus. By retrovirus, we mean its genetic material is RNA, ribonucleic acid, rather than DNA. So then it needs a virus, it needs an enzyme that will change the RNA to DNA. Okay, it needs an enzyme which will deal with the conversion of RNA to DNA, because it is DNA that will now add itself into the genome of the host. Okay, so a retrovirus is a type of virus which has its genetic material in form of RNA. But then it has a special type of enzyme which will change the RNA to DNA so that the DNA can now intercalate itself into the host genome. Okay. So HIV is a retrovirus. It is an RNA virus. But the RNA will be changed into DNA. Okay, the RNA will be changed into DNA. So the components of the virus, if you look at page 7, you have a figure there which shows you the structure of the virus. So you have the RNA, uko ndani kabisa. Then besides the RNA, which is now the genome, okay, which is now the genome of the virus, kando yake kuna hiyo HIV enzymes. Those are enzymes that will now help in changing the RNA to DNA. Okay. Then the genome, it is surrounded by a capsid. So like a cover, like a wallet that keeps the genome. That's the HIV capsid. Then as you move out, as you move towards the outside, you have an envelope. So a HIV virus is enveloped. Iko na kitu yenye inafunika the entire virus. There are some viruses which are not enveloped, but this one is enveloped. Like the COVID virus was enveloped. Okay, it was enveloped. This one is also enveloped. It has a membrane surrounding the entire viral particle. Then on the envelope of the HIV, there are projections, which we call glycoproteins. For those who do biology, in your cell, when you get to a level where you'll be studying cell biology, you'll be taught the various classes of proteins, and one of it is a glycoprotein. A glycoprotein is a combination of starch and protein. Okay, is a mix of starch and protein. So there is an importance of these projections. You remember even when you are seeing the COVID virus, pia ilikuwa na such projections. Okay, we will see at some point what they help in doing. But that is how the HIV virus structure is. It has the genetic material as RNA. It has enzymes that will help to change the RNA to DNA. Then the enzymes and the genetic material are covered, are enclosed in a capsid. Then the entire virus now is also enveloped. It has an envelope around it. Then there are projections, finger-like projections on the envelope. Those finger-like projections, they are made up of glycoproteins. Okay. Two important glycoproteins is glycoprotein 120 and glycoprotein 41. We'll see the importance as we proceed. Someone had carried up his hand. I don't know kama alibeba kimakosa ama alikuwa na swali. Somebody is asking, what are some of the merits of HIV and AIDS in our daily lives? Merit, do you, like a merit is an advantage. So do you want to say what is the advantage of HIV? I don't know. Someone has lifted his hand. Type your message, your question. I will read and answer. Someone is asking, what is CD4? Okay. So these cells, you have cells, you have CD4 and CD8 cells. So CD is classical differentiation 4. Then the CD8 is classical differentiation 8. So there is a way in which people who do cell biology will differentiate these cells. So the one they differentiate at level 4 becomes the CD4. The one they differentiate at level 8 becomes the CD8. It's just a way of classifying the cells. Okay. But now the CD4 helps to prevent infection. But the CD8 removes any cell that is infected. That's the difference. CD4 prevents infection, but it is the same CD4 which is targeted by the HIV virus. So it means when someone is infected by the HIV virus, then it means they are the CD4 cells that will have the infection. Then your body will now get many CD8s to come and remove the CD4s that are infected. So at the end of it, upon infection with HIV, you end up having more CD8s and few CD4s. Okay? Because the CD4s will be targeted by the virus. The virus itakuja ishike hizo. Then CD8 itakuja itoe any cell that has a foreign body. So the CD4s will already be having the virus. So hizo ndio zitaanza kutolewa. Then now you end up having a low CD4 count. A low CD4 count. So how does the HIV virus infect the body? How does it get into the body? The easiest way is for me to take you to this diagram on page 13. I'll take you to the diagram on page 13. So what happens? Before HIV infects your body, the HIV will be outside your body. So for it to enter, for you to enter, you need somewhere to pass through. So for the HIV virus, it will need to attach to the host. It needs to get something for it to hold onto the human cell. Then once it is there, once it has targeted the human cell, gotten into the CD4 cell, because it enters your body, then targets the CD4. Okay. So the first bit is attachment. It has to come and attach. Then after it has attached, it will enter, it will gain entry into the human body as a host now. Then once inside, the second step is now the changing of the RNA to DNA. The enzyme that does that is the reverse transcriptase. That is the enzyme that converts the RNA to DNA. So the virus was outside. It attached using the glycoproteins, the finger-like projections zenye zilikuwa. Then hizo ndio itatumika kushikana na there are some cells on the CD4. There are some projections on the CD4 zenye itashikana nazo. Then it will now gain entry. Once it gets into your body, the first thing that happens, the changing of RNA to DNA. Reverse transcriptase makes DNA from the virus's RNA. Once the DNA is made, the third step is fixing the DNA of the virus into your DNA as a person. Okay? Because the virus cannot make its own proteins. It needs to use the mechanism of the host to make its own protein. So how does it do that? It has to ensure that its DNA is now part of the host DNA. So it has to integrate integration into the host cell's nucleus. So once it has joined the host's nucleus, then as the genome of the host begins to undergo replication, then components of the virus pia zinaanza kutengenezwa, because the viral DNA is now part of the host DNA. So as you make your own proteins, copies of the virus pia zinatokea hapo. They are viral components because the virus DNA is now part of your DNA. So the various components of the virus that are being created as the host genome undergoes replication, they now need to be assembled. So there is the assembly of the various components that are being coded for by the DNA of the virus, which is now currently in the host DNA. So assembling just tries to create a new HIV virus, because there will be part of it which is an envelope, there will be part of it which is the RNA, there will be part of it which is the capsid. So zote zinawekwa pamoja. Then now you have a complete new HIV virus. Okay. So once that new assembled HIV virus is ready, it has now got to be released. Itoke kwa hiyo cell so that iende infect other cells. Okay. So that is what hiyo kutoka inaenda on the edge of the cell. We call it budding. Then it BUDDING, budding. It will go there, then itatoka iende. Okay. So the steps are 6. Attachment, then it enters. It attaches, then it gains entry. Once inside, the viral RNA is changed into DNA by an enzyme we call reverse transcriptase. Once the viral DNA is formed, that viral DNA is now integrated or intercalated into the nucleus of the host, in this case, a human being. As the nucleus, as the genome of the host will be undergoing replication, the host will be desiring to produce its own proteins. But in doing that, because now the viral DNA is part of the host's DNA, proteins of the virus will also be created. So once they are produced, they will now need to be assembled so that we get new HIV viruses. Once those viruses are assembled, they now need to leave that cell. So they have to be released. Upon release, they will now go and attack new cells. And then now the process repeats itself. The process will repeat itself. So that is the life cycle of the HIV virus. When we'll come to a point of looking at the antiretroviral therapy, the ART, we will see how the ARTs function in targeting these steps. Okay, so there will be an ART, for example, that will try to stop the attachment. There will be an ART that will try to stop the making of DNA from RNA. There will be an ART that will try to stop the joining of DNA into the host DNA. There will be an ART that will try to stop the formation of those new viral particles. Then there will be an ART that will try to prevent the release of the formed HIV viruses. Okay. So what the antiretrovirals do, they target the life cycle. They target these steps. So you'll have an antiretroviral drug targeting a particular step in the life cycle of the HIV as a virus. Okay. So I've taken you through the life cycle, but up to that level, now the virus will be ready to leave the body, the cell, and go infect another cell. But how then does the progression from the point of being infected with the virus to the point of now developing AIDS? Remember, we said you will get infected with the virus, but if you initiate treatment, you can either delay or you might stop progression up to the stage where we have now the full-blown effects, which is now the AIDS stage. But in between those two, what are the stages? What are the stages that are involved? Okay, between. So you don't immediately change from HIV to AIDS. It takes time. Okay, there are intermediate phases in which the virus will have to replicate and spread throughout the body. As it does that, it will be weakening the immune system gradually. Okay, because it is targeting the CD4. It's targeting the CD4, which are the ones that fight infection. So if it continues to target them unabated, then we reduce, and eventually you have either very few CD4s, which means it's like having a very important place that is not under any security watch. So by the time you have a lot of the CD4s destroyed, then at that particular point, your immune system is extremely weak, and you are so close, if not by that time already, having the full-blown AIDS. So the progression from HIV to AIDS happens in these steps. One is the acute HIV infection, which is now the earliest stage. So the timeline for this acute HIV infection is between 2 to 4 weeks after exposure to HIV. Okay, 2 to 4 weeks. And at that particular stage, most of the symptoms you have is like you have just flu. Okay, so fever kidogo, you feel like you have swollen lymph nodes, you have a rash here, you have some muscle pains. Okay, so those are just the normal flu-like symptoms. But then the virus will have begun replicating inside us. And if someone have now to check the amount of virus present in your blood, what we call the viral load, during this time, the viral load will be significantly high. Okay, but because the immune system has not been destroyed to a very large extent, it will still be trying to fight back. Not many of the CD4s have been destroyed yet. It's just 2 to 4 weeks after exposure. Okay, so it means you'll have some of these symptoms, but zinakuja zikipotea. Zinakuja zikipotea. So the only way for you to know during this acute infection stage is if you underwent a test, a HIV test. That's the only way that you can for sure know that you have HIV. But the symptoms zitakuwa zinakuja zikipotea. Okay, so you have a rash, you have a sore throat, you have fever, inapotea. Okay. So if it happens that you had infection, exposure to HIV, but you were not aware, so it means then you've not initiated any treatment. Then now it will proceed to the next stage, which is now the clinical latency stage. Okay, so this one can last for several years. It can even take 10 years if not treated. The treatment here, we are not saying if not cured. There is no cure for HIV. It's only treatment. Okay, it's only treatment. So the treatment here ni kuenda for antiretroviral therapy, kuenda kuwekwa kwa hiyo madawa. So the symptom, by this time almost symptoms zimepotea sasa. Okay. Hii ndio ile wakati huo unaona mtu anasema walikuwa unasema fulani alikuwa rafiki ya huyu mwenye alikuwa na ukimwi, but ukimwangalia hata huwezi jua. Okay. Now you are within that period where the symptoms are, you are not experiencing any symptoms. So your body is almost back. But it is only happening, what is happening inside you is that the viral replication is continuing. And the immune system is still able to fight because it has not been destroyed largely. But if you went for a viral load test to go and determine the number of virus within your blood system, you realize that the viral load might even be lower. Okay, but HIV is still destroying the immune system. And now the CD4 cells, the count of those cells is beginning to decline. Why are they declining? Because the CD8 are now mopping out the CD4 cells that have foreign bodies in them. So these CD4 cells will be having a lot of HIV viruses attached. Then now the CD8 cells will come and begin to remove the CD4s. So most of the CD4s at this time will have the virus inside. Then now the CD4s datolewa. So you have a very low CD4 count. Remember, with a very low CD4 count, it just means your immune system is already low. So from there now, if no treatment still, then you are likely to now progress into the AIDS stage. Okay, into the AIDS stage. This could take between 10 to 15 years, but there are people who will even take 3 years to get to AIDS. So it varies from one person to another. But if there is effective treatment, we're not saying cure, if there is effective treatment, when you have HIV, you can still live long. You have a very healthy life, and you will not develop AIDS. Okay, you will not develop AIDS. So when we talk of now the AIDS stage, what are the symptoms? So one of the main symptoms now is that the immune system is extremely weakened. Okay, remember the CD4 cells, the count imepunguka sana. And there are these CD4 cells that are supposed to help us to fight infections. So ukipunguza the CD4, umetoa watchman. So mwizi akitaka kuingia ataingia. Now the opportunistic infections, you now begin to suffer from tuberculosis, what you never suffered before. There are some certain cancers that you begin to suffer from, which normally you couldn't when you are immunocompetent. By this time, someone is now immunocompromised because the immune system has been tampered with. So when you do a CD4 count for someone at this stage where the immune system is severely weakened, then you'll find that the CD4 count is very low. And mostly it will be even less than 200 cells per cubic millimeter of blood. The normal range is between 500 and 1,600. But when you are having it below 200 as your CD4 count, then surely by that point, the ability of your body to fight infections, because they are the CD4s that help. So you'll have reduced them so much that your body will not be able to competently fight infections. So you can get HIV, but if you initiate treatment, you can either prolong or you can either not get to the AIDS stage at all. There is no cure for HIV, but there is a way you can protect and there is a way you can manage. So we'll be looking at that as we proceed. So we've seen how HIV weakens the immune system, okay, because it destroys the CD4 cells. But now, we've talked about treatment. How can you treat HIV? By using the antiretroviral therapy. So antiretroviral therapy, you take a combination of drugs. So ART is a combination, several drugs. And what these drugs will be doing is that they will be targeting different stages of the HIV life cycle. We saw those stages. Okay, so you have several drugs that will be targeting different stages. Okay. So what is important is antiretroviral therapy does not cure HIV. Okay, does not cure HIV. It will only help to control the virus so that the person who is infected will now be able to live longer lives just like any other healthy person. So we always say that although few people are infected, all of us are affected. With the HIV, there are only some people who are infected, but all of us, we are affected. Okay, we are affected as human beings. But the people who are infected could be significantly lower, less than all of us. So the classes of the ART drugs, they are those which would be blocking the reverse transcriptase enzyme. The reverse transcriptase enzyme is the enzyme which is changing RNA to DNA. RNA to DNA. So that class, that group of drugs that prevents or blocks the formation of DNA from viral RNA is the reverse transcriptase inhibitors. Then we have another class, which is the protease inhibitors. So protease inhibitor, what the protease does, it helps to assemble the various viral particles to create a mature HIV virus. So if you have that protease inhibitor, it will stop the putting together of the various particles to create a mature virus, which can now live to go and infect another cell. The integrase inhibitor, once the reverse transcriptase has converted RNA to DNA, that DNA will now have to incorporate itself into the host genome. So the integrase inhibitor will stop that incorporation of DNA into the host genome. Okay. So you'll have the DNA of the virus formed, but it will not be able to join the host genome. If it doesn't join, then we will not have that DNA of the virus being replicated to create proteins that will form a what? A new virus. Then fusion inhibitors and entry inhibitors, they prevent the virus from entering the host cell. So you can think of this, ni kama uko na gate kwako, ama ukilala usiku unafunga your room. So hii ni kama ile lock unatumia, utaki mtu aingie kwa room. Okay? So there are a class of ARTs that will prevent the entry, will block the virus from entering the host cell. If the virus doesn't enter, then the virus will do what? It will die because it cannot live on its own. That's about treatment. Remember, there is no cure. You can only treat and prevent. So how is the prevention done? One, you can try to use medication ahead of the probable exposure. So we call that the pre-exposure prophylaxis. Pre-exposure prophylaxis. Most of you just call it PrEP. So this is a daily pill which can prevent HIV infection in high-risk individuals. We've not said is a daily pill that prevents. The word is can. Kumaanisha it may or it may not. Then the second mode of prevention is condoms, if they are used properly. Okay, if the condoms are used properly and consistently. Then the other way is there are people who inject drugs. So most of these people will share needles. Okay, so if there is a way in which this has to be stopped, either you stop people from using drugs, or if you realize that there are groups who can just not stop, then you provide them with clean needles. Then now the last way in which you can prevent is if we can stop the mother-to-child transmission. So HIV positive people can also live life just like any other person. They would marry. If they consistently use the ARTs, their levels of the virus will drop significantly. Then now it gets to a level where when we say it is undetectable, it cannot be transmitted at that particular time, then those people can now try also to conceive. So if there is a mother who is HIV positive, na akona mimba, okay, there are ways in which can be put in place so that the HIV positive pregnant woman cannot transmit that virus to the child. So they will take ARTs, I think from the second trimester until wazae. Then wakati ya kuzaa, they will not do the normal path. They will undergo cesarean section. Okay. So with the cesarean section, what you are trying to prevent is the contact between the blood of the mother and the child. Then after birth, mtoto atapewa ARTs for some time. ARVs atawekwa kwa hiyo combination for some time. Akipimwa, I think up to the 3rd or 4th month. Ikionekana kwamba the child is negative, then they stop the ARV usage. But of most importance ni kwamba huyo mtoto asinyonye. Hiyo ndio kitu ya maana. Huyo mtoto asinyonye. Because the milk of the HIV positive mother will most likely have viruses. So that means when you are playing sex with someone, you've put on a condom, but you are busy sucking their breast. Huyo mtu kama kuna ukimwi si utapata. Okay? Well, we'll talk about it at some other point. So we've seen the HIV life cycle. Let's see now how the transmission happens. Let's see how the transmission happens. So let's see how the transmission happens. Okay, so transmission ni venye hiyo mwenye ako na virus ataipitisha aje iende kwa mtu mwingine. Okay, so why is it important for us to understand these transmission routes? Okay, why is it important for us to understand this? So it is important, ukijua kwamba mwizi mwenye ananiibianga kwangu anapitianga kwa hii dirisha, utaita welder akuja afanye namna gani? Chomele dirisha. So when we understand ways in which transmission of this virus happens, then we can now employ prevention strategies. Okay, because the HIV epidemic is of significant public health importance. So what are the common routes? One is the unprotected sexual contact. So you end up either being heterosexual intercourse or homosexual intercourse, okay, with someone whose HIV status you don't know, and you are not using any protection. So that increases the likelihood that in the event that any of you is infected, then the other person is likely to be infected as well. We've talked about sharing needles for people who inject drugs. Okay, so if one of the persons who are injecting drugs, because largely the virus is found within fluids in our bodies. Okay, so that's blood, breast milk, and many other fluids. Even the vaginal fluid, basically, it will have it, the vaginal secretion. Even the semen will most likely have it. So if ways in which this sharing of needles, sharing of things that can transmit these fluids is not stopped or is not made safe, then HIV transmission is likely to continue. Another one is mother to child. Okay, so if the mother to child, if the mother is HIV positive, then the child can get the virus during pregnancy, during childbirth, or in the process of breastfeeding. So during pregnancy, that's why now they have to put in the ART. They have to put in some the mother to some ART, the drug at some point from the second trimester. Then during childbirth, mama hatazaa the normal way, watazalisha yeye through cesarean section. Then another way to stop it is that the child will not breastfeed. Okay, the child will not breastfeed. So it is important now that for mothers, when you present to hospital pregnant, among the very first tests they do, one of them is the HIV test. Because once you are pregnant, it's no longer just about your life. It's also about the other life that you are carrying. So they need to determine, are you HIV positive, for example, so that if you are, then there are measures which need to be put in place so that the child you are carrying should not be infected with that viral infection that you as the mother carry. Another mode of transmission is when either you are undergoing blood transfusion or an organ transplant. This is largely insignificant because most of the blood before ile imetokea kwa public blood transfusion centers, itakuwa wamefanya tests for most of these infectious diseases. But it is currently coming up kwamba there are some people, some hospitals, private ones especially, zenye wanaweka their own blood transfusion services. So huko you cannot guarantee, okay? But if it is done properly, then blood transfusion and organ transplant should not be such a risk because they should be screened ahead of time before they are given to a patient. But in case they are not, in case they've not been screened, then they offer a significant risk of infection. But then there are other ways in which there cannot be transmission of HIV. For example, if someone is HIV positive, you can hug that person, you can shake hands, you can share food, okay? You can share a drink. The only thing is if that person doesn't have a cut in the mouth, if that person doesn't have a cut kwa mkono yake, or when you are hugging that person, there is no cut penye kuna fluid ile itatoka kwake ikuje kwako. Okay, with the fluids I don't mean sweat, but I mean things like blood, because that will have a significant amount of the virus. So yes, you can hug, you can shake hands, you can even share a bed with someone who is HIV positive. The thing is, so long as they don't have a cut. So ukipata roommate, then siku moja unagundua tu, ukiangalia sijui nini, unaona huwa ana attend this HIV clinics, sio kuanza kutafuta venye unatoroka. Is now for you just to know kwamba huyu mtu ako infected, but this is how I can live with the person. Sio akiingia kwa room wewe unatoka. Okay? Then you cannot spread, we can't spread HIV through air. So ati ukijua huyu ako na virus unaanza kuvaa mask everywhere around that person, unavaa mask. Hapana, you cannot have that transmission. Then of course mosquitoes cannot transmit through the bites. But now, how do we test? How do we know? Okay, how is the HIV infection diagnosed? So it is a very crucial revelation. It's very important for you to diagnose in a timely way, very early on. Ujue kama uko na ugonjwa ama hauna. Because if you have, then you initiate treatment. If you initiate treatment early, then you reduce chances that you will develop up to AIDS stage. Okay. The second thing is, if you realize you don't have the disease, you don't have the infection, you don't have the virus, then now you can put in mechanisms to ensure that you prevent yourself. In the event that you realize you have the virus after diagnosing, then now you can put in mechanisms to live positively and not to be a risk to the people who are living with you. So diagnosing HIV is important, and it should be done very early, because the earlier you do it, it enables you to have knowledge, either to put in treatment early, or if it turns out that you are negative, to stop indulging into risky behaviors. But if it turns out that you are positive, you now have to change your lifestyle in a way that you can live positively and you don't become a risk to other people. Maybe before I begin the diagnosis bit, I'll check and see if there are questions, then I'll answer before I proceed. There are people who are just arguing about mwenye alinyonya nani. Okay. Someone is asking if your parents know kwamba bado mnanyonya. Someone is asking, is it true that ukishare deep kiss, you get affected? Did you mean infected or affected? Okay. Did you mean infected or affected? Let me assume you meant infected. So most of the time you'll have a cut somewhere in your mouth without knowing. Okay, most of the time. Most of the time you'll have a cut in your mouth. Now you are brushing, ulikuwa unakula na fork na ikakudunga, ulikula miwa jana na something just happened to your mouth. Okay, so if it happens that way, then it means if you now get so deep, because you're using a deep kiss, okay, so then it means there is a possibility that the virus could now go through that cut. There's a fluid, there's blood that will come. There's no virus in the saliva. Okay, there's no virus in the saliva. But there is a virus in your blood. There is a virus in other secretions that come from your body. So the reality is there will always be a cut somewhere in your mouth. So anytime you really want to give what you say a deep kiss, know the status of the person you are engaging in deep kissing with. Okay. Yeah. Know that person you are engaging in deep kissing with. Because at the end of the day, you are likely to share secretions that are just deeper than saliva. If that happens, then surely if one of you is infected, then the other person is infected. I said only a few are infected, but all of us are affected. Someone is asking, at what age can someone be infected? If there are children who are being born with the virus, then it means you can be infected at age is nothing. So si ati ni ugonjwa ya watoto ama ya watu wakubwa, you will get infected irrespective of the age. How long does it take for one to be detected you have HIV after having sex? It depends with the method of diagnosis. Okay, there are methods zenye zinachukua 3 months ndio wajue, but there is another method that if you engaged in sex now and nakupima the next 10 minutes nitajua. Okay. So there's what we call in diagnosis sensitivity. It depends with the sensitivity of the method you are using. If you are using a very sensitive method, just like pregnancy, I will know immediately. But if you are using a method that is less sensitive, then it needs to take some time before what you are looking for becomes available. Okay, so I think, how long does the virus stay on sharp objects? AIDS as a virus itself is very weak. Okay, ukitoa the virus ya HIV uweke hapa juu, it will die within seconds. But if it is ikikuwa kwa damu, ikikuwa ndani ya damu, then it can take even a day or two. Okay, it can take a day or two and it will still be alive. Okay. Someone is asking, is there any problem if one with the HIV engages with one that is also infected? Yes, we have what we call serotypes. Unaweza pata HIV ya aina moja na mtu mwingine ako na HIV ya aina ingine. Okay, so you can have HIV1, HIV2. They are clades or serotypes. So if you have one and you say, because I'm now HIV positive, so acha tu, I don't care. You increase chances that you can now contract another different sort of type of HIV or clade or serotype of HIV. Okay, so it is not just saying because I'm HIV positive, so acha kiumane. Hapana. You risk yourself even more. Once you know you are HIV positive, then you need to leave ukijua kwamba you can risk your life even more. Can someone with blood group O positive get HIV? Yes, you get. Blood group is nothing, utapata yote. Utapata yote. Okay. Someone is asking, does a person born with HIV undergo the stages of HIV? Yes. Okay, yes. So every person will undergo those stages. That's why it's important kwamba you undergo diagnosis mapema so that you initiate treatment early to reduce the risk for you developing AIDS. Okay, so all of us, when you are infected, you will undergo those stages. So there are others which I will not answer because I think it's, and I can tell you, kupata supu unapata. So don't take like this course ni ya mchezo ile naona mnaweka hapa kwa nini. Okay. Ni msifikirie tu ni mchezo hivi. Okay. So it's an awareness, yes, but then it's just not a waste of time. The way I'm seeing most of you ask questions here. Okay. Someone is saying, is it true you can have sex with an infected person and yet come out unexposed only when you use, one, protection in the right way, two, if the infected person was using ARVs, was on ART. Mtu akitumia the ART, inafika mahali inapunguza the viral load, the number of viruses in the blood of that person. So it gets to a level where we say it is undetectable. So the person is still HIV positive, but the virus cannot be detected in the blood of that person. So hapo ndio huwa wanaambia nao couples, if you are having a partner who is HIV positive na mnataka kuzaa mtoto, so mnaambiwa kwamba now you can try at this time to have unprotected coitus, because it is only after the virus has gone undetected that then the person who is infected is likely not to infect you. Okay, so those are the only incidences. Either you are using protection or the person who is infected in this case is on ARTs. So ametumia ARTs mpaka zimepunguza the viral load. Who should get tested for HIV? Everybody. Okay, everybody. Everybody should get tested. At which stage of HIV a newborn child is, assuming he or she is being born? That is the first stage, because hapo ndiyo atakuwa tu exposed to the virus. Okay, atakuwa exposed to the virus at that particular level. Well, you could think that if you become pregnant and you are HIV negative, then with the pregnancy, you are pregnant, then your partner goes out and gets infected, then comes back home with the infection, yet you are pregnant already. So you have the child in you. Then as you get intimate, you are pregnant, your husband has come home with the virus, then he infects you. So ulikuwa umepimwa mapema, ukaonekana hakuna ugonjwa. Then at some point, you now get infected later on. Okay. So usually what happens, the testing for HIV happens repeatedly. So they don't just test you once for watching. Okay. So when you are nearing, maybe after 4 or 5 months, they will test again. So waone, have the status changed or not? Okay, have the status changed or not? And once they realize that you are positive, because you are carrying a new life in you, another life in you, they'll now enroll you for ART to help you and also to protect the newborn. So U4U in HIV AIDS is undetectable and transmissible. So you get to a level where you cannot detect it in the blood, which means now the viral load is very low, almost non-existent. At that particular point, now you cannot transmit it. Okay, that's the UU. If a person has undetectable HIV levels due to treatment, what will happen if they donated blood or an organ? Will it still be considered completely unsafe? Yes. When the person who has the viral levels very low, huyo mtu bado akifanyiwa diagnosis ya HIV, it will turn positive. Okay. So by having a very low, by the time you cannot detect the virus in your blood, does not mean wakikupima haitaonekana, itaonekana tu. It's only that it is not present in the blood. Okay. It is not present in the blood, but still, wakipima, if they do diagnosis, we'll see how diagnosis is done. If they do it, it will still send a positive result for the HIV presence. Only that it is not the virus, the number of viral particles in the blood will be almost non-existent. we said very well that there is no cure. So you cannot say PrEP inatibu ama ina prevent. We said kutibu is to cure. Okay, so there is no cure for HIV. So PrEP is just for prevention. PrEP is just for prevention. Okay. Answer me, please. Is there blood groups which cannot be infected? No. Blood group itakupata tu. Okay. But, Daktari, kuna PEP. If one engages in sex with the HIV positive individuals, he or she is supposed to take PEP to avoid being infected. So we have PrEP, which is taken before the infection. Then you have PEP, the post-exposure prophylaxis. You take it after a possible exposure. All of this is prophylactic, which is just preventive. And it is not 100% sure kwamba ukimeza PEP ama PrEP itakinga ukimwi. Okay? So PrEP is before, PEP is after. Okay? So you have those prophylaxis. And they are not meant for now you guys hapa because hujui nani ni nani, so wacha nimeze PrEP, ama nimetoka kwake na simujui status yake, so wacha nimeze PEP. PEP is meant for accidental exposure. Maybe you were raped. You were involved in an accident and people were bleeding. So you are not sure if the blood you came in contact with is blood from an infected person. So you have to take the PEP. Okay. Sio hii yenye umeenda kulala ukijua tu kabisa naenda kwa boyfriend yangu whom you don't know the status. Okay, so you go sleep with them and then very early in the morning unaanza kutafuta PEP. Okay, that's not what it's meant to do. It's meant to be sort of an emergency thing. What if it is a rape situation? What can be done? Now take the preventive medication. So what you do if you are raped, the first thing you do is you take, now after, because raping, it means you already have been exposed. So you don't go for the pre, you go for the post-exposure. So take the PEP immediately, because if you take long, virus itakuwa imepita kwa stage fulani. So by the time you're taking PEP ya prevent this stage na imeshapita hapo, then the PEP will not work. So in case of a rape, take the post-exposure prophylaxis, go to the police report, then go take a HIV test. Usiende kutest kabla uchukue PEP. The first thing you do, take the post-exposure prophylaxis. That should be the first thing you do. Then the next thing, go report to the police. After that, now go test. Okay. The good thing is, when you've taken the PEP, in case that person had the infection, the PEP will help. Okay. So PEP is the first thing you do. Usingoje ati niende kwanza nipime, hapana. Meza PEP, then fuatilia vitu zingine baadaye. So those are the first things you do in case of an emergency exposure, be it an accident, be it rape. Okay. Take the post-exposure prophylaxis first. Second, go report to the authorities. If it's in a university, you know where to report. If it's the dean of students, then now you proceed, okay, to the security and all the other people. Then after that, go test. But you'll have taken your PEP first. People have raised hands, but can we finish? Can we finish? Does HIV have a vector? What is a vector? A vector is like a border. Okay, what carries it from a host, from the source to wherever it has to infect. So HIV doesn't have a vector. Okay, so there is nothing that can transmit the virus from one human to another human. There is no vector. Okay, there is no intermediate host, like we'll talk of other diseases. Okay, there is no intermediate host. Is it true that if a person with HIV positive accumulates a Panadol, it will test negative? No, it is not true. Someone is asking that you are at a point of very serious kutu and you don't have protection. So it's for you to choose. Do you want to die? Can you die of the kutu, or you can die of the virus? So choose how you want to do it, to die. If you think kutu can kill you, then look for protection. If you don't have protection, I'm sure you can live with the kutu. Okay, I'm sure you can live with the kutu. Okay, what about a HIV carrier? There are no carriers for HIV. There are no carriers for HIV. You don't say the male reproductive organ is the vector. Even females infect males. Okay, so it's not true. It's not true. Anyway, enough of that. There are people who've carried up their hands. I will not allow you to be unmuted now. I'm not allowed to be unmuted now until we are finished. If your question is so burning, andika hapo chini. Will not unmute anybody now. So I'll go to diagnosis. We say diagnosis is crucial because it tells you if you have the infection so that you can initiate timely treatment. If you don't have the infection, you can continue preventing yourself. Okay, that is the importance of diagnosis, which means the earlier you undergo the diagnosis, the better for you. Okay, the earlier you do it, the better. So in the modern times, there are tools which are available, and they've now made the detection of HIV to be fairly early and easy. So you can test either yourself or you can go to a health center and they will help you get tested. All along, in most public institutions, it's been free because of the donor funding. But now with the complications that are coming up, we don't know how the situation will change going forward. So the methods through which HIV testing is done, there are some of these rapid HIV test kits. Hizo ndio watu wengi huwa ukienda, they prick your finger, they take your saliva. That is a rapid one. Within some 5 minutes, you already have your test. That's a rapid one. It's mainly based on the testing the presence of antibodies. Okay. The other one, which is more sensitive. So the first one is a rapid HIV test. That one cannot tell you. Someone asked that after how long. So if you got exposed now, then you went to a health care center where they tested you using the rapid HIV test method, chances are very high kwamba itaonyesha negative. Because what the rapid HIV tests look for Okay, look for it. Happens, it builds in your body after some time. Ndio ulikuwa unaambiwa hapo nyuma after 3 months urudi, because it takes time before the antibodies against this virus build up in your body. So if you go for a rapid one, it depends when you had the last exposure. It is likely to return a false negative. Okay, a false negative. The ELISA, which is enzyme-linked immunosorbent assay, that one tests for some proteins against the virus. So by the time the proteins are present in your blood, it means truly the virus is there. Okay, the virus is there already. So it means then an ELISA test is more accurate. When you get a positive result for an ELISA test, because it is testing the presence of some protein inside your body, that protein is only present if the virus that is creating it is also present. So it is more accurate. Okay, it is more accurate compared to the rapid HIV ones. Most of the time, if you go on a kuulizanga, when did you have sex last? So if you say today morning, surely if they did a rapid HIV test, they will just tell you after 3 months urudi, or after this time urudi. Okay. So the third one is the HIV RNA test. That one now tests for the presence of the RNA, the RNA of the virus. So it means this is even more accurate, because inaonyesha sasa, if you have the RNA, then you surely have the what? The virus. Hii ya mwisho, number 4, the home-based testing kit. Hii ndio ile mnanunua kwa chemist. Then now you can go test yourself. Why this came into being ni kwamba kuna watu wengi wanaogopa kuenda kupimwa tu. So they prefer kuenda kujipima wenyewe. The only challenge, the main challenge with the home-based testing kit, before you are tested for HIV, there is a bit of counseling. Okay. So you are told what it means, what this means, what that means. So you are prepared, sort of. But if you are testing yourself in the house, I mean, the reality is most people go for a HIV test just to prove how negative they are. No one goes there to prove that they are positive. Unaenda hapo kupima ukijua unataka ipatikane uko negative. So if it happens that you bought this kit, gone home, then you test yourself in the house and it turns out positive, then usually the worry is, how will you take the results when you are alone? Okay, that's the main worry with the HIV infection, with the home-based testing kits. Okay, so the best way is, if you have to be tested, at least go where you can be offered care. Most people wakipima hii akiwa peke yake, that's where you find kwamba mtu alipatikana amekufa, because they didn't have that assurance. There was no one to support them morally after the test. But it was created for people who want a bit of privacy. Okay, you can think of some of these leaders, your area MP, walking into a health institution, wapime wajue MP fulani yako na hii. People will move around, waseme usiambie kwa mtu, lakini najua fulani yako nayo. So most of them prefer to be tested privately. And now that's why some of these home-based testing kits were brought about. So do we have special populations in terms of diagnosis? Yes. Who are those? Pregnant women. Okay, so it is important that pregnant women are tested, because in the event that they are positive, the child should be protected. In the event that the pregnant woman is positive, the child should be protected. So that's why for the special populations, for them is not voluntary. It is sort of, we must test. Okay. With children, the infants, pia watapimwa. Not that the child wants, okay, but it is in the interest of the public health practitioners that pregnant women and children, their HIV status is determined, is diagnosed, so that prevention mechanisms can be put in place, treatment can be put in place early. So those are the special populations, special groups with respect to diagnosis. So these are the special groups, that groups whose testing is not voluntary. They don't need to say yes. You know, if you just went to hospital na upimwe HIV bila wewe kujua, you can sue that hospital. But for a pregnant woman, for an infant, the law allows it. Okay, the law allows it. That wapimwe. So those are special populations. Why are they special? Pregnant woman, if the pregnant woman is infected, then mechanisms should be put in place to prevent the child. If the infant child is infected, the child should now be put on treatment to ensure that he or she lives a normal life, just like any other person. Because there are people who are born with this virus. It doesn't mean that walihanya, they never did anything. They were just born with it. But why are they still alive now? Is because they were tested early enough. Okay, so once they returned a positive test, treatment initiatives were put in place to ensure that the infection can be managed and they can live a long, normal life, just like any other person. Okay. What we have as example is just giving us the prevalence. So we have people in Kenya who have the virus. But the good thing is ARV has been initiated widely. It's only that now we have a challenge because the USAID has pulled out, but we hope the government can plug that hole. Okay. We have the prevention programs. You have the PrEP, you have the PEP, you have the sort of these awareness programs. You have condom supply, which is free. Okay, so those are prevention programs that are being put in place to ensure that we can stop the transmission of this virus. Okay, we can stop the transmission of this virus. So it is difficult to say that we will not have people who are infected, but it's possible to say that we can stop new infections. Okay, we can stop new infections, but it's difficult to say we will not have people who are infected, because then you cannot go around killing people who have the virus. But you can come up with ways in which you ensure that no new individual, no person is added into the already infection numbers. Okay, so we can come up with the preventive mechanisms to help do that. Okay. Yes, so I think I'll now go and see the questions. So the ones who wanted to ask questions, you can raise up your hands, then they can unmute you and you can ask them. So if you have a question, then someone is, I will not mentioning name. Someone is putting in a very good comment. Munaweza dhani sina ukimwi, lakini kumbe sina. Okay. So what that means is most of the time tunapima na macho. Okay. So there's someone who might be, kuna msichana unakuwa unaangalia zamani, and then you feel like, huyu ni msichana mzuri. Then one of these days you've been trying kwamba upate muongee lakini humpati kabisa. Then a day now she comes, you find her somewhere. Most people will not go and aseme wacha ningoje tutaenda tupime. Utaangalia tu useme huyu kama angekuwa ako na ukimwi haiwezi kuwa mrembo. Msichana mmenona hivi, huyu haiwezi kuwa nayo. So unapima na macho. Okay? So hiyo ndio kusema mnaweza dhani. So tusidhani, enda upitie hiyo diagnosis. Okay? Go get tested. The good thing with it ni kwamba it's no longer a death sentence. In fact, the earlier you know that you have it or you don't have it, the better. Okay? The earlier you know, the better. So let's not just say mnaweza dhani ama kumbe niko nayo na kumbe sina. Okay? Tutoe hiyo ya kudhani, tuseme ninajua sina because umepima. Someone is asking for notes. I sent the notes last week to your class reps. Okay? To your class reps. Mtu anauliza PEP ni gani na PrEP ni gani? PEP is post-exposure. PEP is post-exposure, which means after the exposure. Okay? So you think you've been exposed. You got intimate with someone whose status you don't know. There is a risk kwamba you might have been exposed. So you take the pill. The pre-exposure is when you are looking forward to the exposure, to the possible exposure. So PrEP is preventing before, but PEP is dealing with it after the exposure has happened. This one I will mention the name because it's a very good question. Why is there still no vaccine when we developed the COVID vaccines so quickly? That is Meshach Kiprop. Meshach, the biggest problem with the HIV virus is the mutation rate. So it changes. It changes. What a vaccine does, a vaccine ni kama ile venye nyinyi mkitoka nje mkirudi, you have to show your ID before uingie. Usipoonyesha ID hawatakuruhusu uingie. So they'll have prevented you from entering. So a vaccine prevents an infectious agent from getting into an individual. But even most of you mnasaidiananga ID. Unaweza pata Mesha kamechukua ID ya Brian na anatumia kwa gate because hawajui jina yako. So that is the sort of mutation. The virus keeps changing. So just like you can even use ID ya msichana sababu hawataangalia jina na uingie yetu ya Raman, or even your girlfriend atumie your ID, is the same thing that the virus keeps changing. So that even if a vaccine is developed, by the time the vaccine is complete, the virus has changed. So the vaccine is not effective against what it was developed for. Because the new HIV virus will have changed into a different, we call them clades. Okay, so the mutation is the problem. Mutation is the problem. That's why it is still problematic. If scientists get to a point where they can stop the mutation of the HIV virus, then we surely can have a what? Can have the vaccines. Someone is asking what is meant by prevalence. Prevalence is the amount within a population. Okay. So when you say there is a high prevalence, it means within a particular area, if you are talking of the prevalence of HIV, then there is a very high infection rate. So many people within that particular area are infected with the virus. So the prevalence is the amount within that particular area, that particular region. Opportunistic infections, this from opportunistic, they look for an opportunity. okay, is an infection that waits for an opportunity. So opportunistic ones, they will wait when your immune system has been weakened. So things like tuberculosis. Okay, when you are healthy, when your immune system is functioning properly, you don't suffer from TB because the immune system will fight the Mycobacterium tuberculosis. But once your immune system is hampered, interfered with, weakened, then the TB now can take advantage of that opportunity to infect you. So it becomes an opportunistic infection. Okay, so opportunistic infections are infections that will take advantage of a weakened immune system to infect a host. Is weight loss a sign of HIV? No. Okay. Most people think ukikuwa na ukimwi ukonde, but among the side effects za ARVs ni kwamba watu wengi wananona. And that has been the problem. So people will expect that if they say, mimi kwa mfano ikisemekana niko na hiyo ugonjwa, people expect nikonde. But wakiona unanona wanasema huyu walimdanganyishia. Ukikuwa na ukimwi inatakana ukonde, but it's not a sign. Weight loss is not a sign. Okay. Okay. Na nikioa mke ako positive na mimi niko negative, can I end the marriage? So if you marry correctly, then you'll have been taken through the tests at some point. Okay. In this case, I'll assume possibly you are born again. So you are dating, you never had sex. That's why she's positive, you are negative. So it then means if you at the end of it, you realize she is positive and you are negative. Yet you've been having unprotected coitus. Then we say you are a discordant couple. Okay, so there are mechanisms that you can be helped. We'll see that in the next lecture. There are mechanisms that you can be helped. Odell, if you can unmute some people, naona watu watatu wamebeba mkono. Someone is asking, mbona mosquitoes haziwezi? When mosquitoes bite someone, they will be biting you. Actually, only they bite you to get blood, and that blood has to go and do something in their bodies. If they are female, hiyo damu inaenda kusaidia kwa mayai. Okay, itakuwa inaenda kusaidia kudevelop the eggs. So what happens, ile mosquito ikiuma mtu inyonye damu, there is a liquid within the proboscis of the mosquito which ensures that the blood should not coagulate. Hiyo damu isigande. So that liquid has also the ability to kill the virus. Okay, the anticoagulant liquid within the proboscis of the mosquito. And again, ikimeza hiyo damu yenye ikienda kuuma mtu mwingine, isiyo hiyo damu ndio itatoka, because yenye imemezwa is now used. Okay, yenye imemezwa is now used. Okay, so those are the two main reasons why a mosquito cannot. What are the best drinks? We'll see what you do when you've turned positive and what to do when you've turned negative. Okay. I think from what I'm saying, I think we've tackled most, if not. Surely. Ati ni ukweli ati watu wenye wako na macho ya red wako na ukimwi? Hapana. Violet Bosibori ndimu, no, hapana. Not every wewe sasa hiyo at that rate watu wenye wako na ugonjwa ya macho then utawakataa wote, sababu utaona kwamba wako na ukimwi. So sweetheart, they don't. You don't. It's not about the eye, the color of the eyes. Hiyo sasa ndio kupima na macho, mrembo. Usipime na macho. Jamaa akikutaka peleka yeye, mupime kwanza, sio kupima na macho. Tupime kwanza. Does hair color change is not a sign of HIV? Okay, mtu anauliza kwamba nywele ikibadilika rangi. No, it's not a sign of HIV. Someone is asking, kama hiyo fluid ya mosquito iko na ability ya kukill the virus, si scientists watumie hiyo? Surely people have tried already. Okay, people have tried already, and we wait to see how things will turn out. The main problem with the virus is your mutation too. Okay, the main problem is the mutation. The main problem is the mutation. Okay. Up to that point, I think we are through with what we should have, what I wanted us to look at today. So next, we look at after you've undergone the test, because we've seen how the tests are done. But now, after you've undergone the test, what if you've turned positive? What if you've turned negative? What do you do? Okay, that's what we look at next. Then I think after that, we'll have gone through the HIV one, then we move to something else. So remember the first lecture, we looked at public health. The second bit, we are now looking at HIV. Okay, and most of what we are looking at HIV, if you look at the protection, when you protect HIV, you are protecting other STDs. Okay, because the mode of transmission is just the same. The mode of transmission is the same. Okay. There are people who are raising up your hands. Just type. Now, what about slim guys? Because nilishaiambiwa ati watu wakonde wako naye. I will not mention your name, but sweetheart, don't be misled by size. Okay, it's not an indicator. It's not an indicator. Why virus is not classified in the 5 kingdoms of classification? How many kingdoms do we have? We have 5 now. I don't know. But why we don't classify the virus? There is a big contention as whether a virus is a living thing. So there are people who still think that a virus is not a living thing. Okay. That it is not a living thing because it cannot live on its own. A virus needs a host. If you put a virus, ikae tu kando peke yake itakufa. So it's a whole debate whether a virus is a living thing first. Okay. Many pointers indicate that it might not be a living thing because it's just a particle that needs another living thing for it to live. So if it needs another living thing, then surely it's likely not to be a living thing. And if it is not a living thing, then we cannot classify it as part of those kingdoms that you're talking about. Someone is saying, if we tuendelee tu kidogo, you have another class, my good people. Please, sir, during sex fluids come out, how is it possible now that one gets HIV? The fluid that is coming out, that fluid, if the person you are playing sex with is infected, that fluid is likely to have the infection with it. That's why when you are using protection, then you are not exposed directly to the fluid. There is a cover between you and the fluid. Okay, between you and the fluid. So the fluid, if the person is infected, talking of the vaginal secretion, talking of sperms itself, okay, it is likely to have the infection as well. So the only thing for you to do to prevent contact with that fluid, how do you do that? Condom. Or don't engage in sex, abstain. That's how when you are mwezi, that's where you draw the line. So the only thing, prevent, use a condom. So let's assume nimelala na mtu wako positive na niko negative. How long will it take ndio nijue niko affected? What determines how long you take is the type of test you go for. Okay. There are tests that will tell you immediately because they are looking for the protein. If you are looking for the RNA, the presence of the RNA, the virus will be inside your body immediately. So we can detect that viral RNA. If we are looking for the protein will be in your body within at most 30 minutes. Okay, so we can detect the protein within 30 minutes. But if you have to look now for the antibodies, then that one can take long. Ndio ulikuwa unaona hapo nyuma, unapimwa, unaambiwa rudi after 3 months. Now within the 3 months, don't have any other exposure because it was realized that the antibodies will have developed within the 3 months. Okay, so the how long it takes depends with which type of test, diagnostic test you are going for. Okay, yeah, we surely should stop there. We surely should stop there. I will, someone is saying I'm allergic to latex, daktari, nitumie nini instead? So wacha tu kama mimi. Okay, wacha tu, you know, anytime you realize, someone once said that anytime you realize you are using a condom to play sex with someone, then it means that sexual intercourse was not supposed to have been there to begin with. So then just stop. Okay, stop. But because now at your age, if we said you stop, it will be difficult. That's why we are showing you how to continue in a safer way. So you are allergic, then go test your partner. Kama akona ukimwi wachana. Because if you continue using the latex, you are allergic to it. But after you've tested, then you now make an informed decision whether to proceed or whether to do what? To stop. Okay. Joel, I will not answer yours. Ask me that next, then I will answer it. Tutaanza na yako Joel. Sawa. Joel, hii yako nimeiona. Save that question, ask next time. Okay? 2 minutes to 10. Thank you for coming. Alafu nani atamsaidia mwenye ukimwi tuki-avoid? You make a decision on that basis. Okay? There are people who end up, we call it an informed decision. So you end up continuing with that person knowing that we mtu ako na hii ugonjwa. So we will see how do you do that. Okay? Tutaona hiyo now in our next lecture. Umepima, umeona you really love this girl, but surely she was raped yesterday. So what do you do? Okay, what do you do? So we are not saying that you actually stop, but ukimaliza kupima, you will now you have an informed decision. Ukijua unaendelea, then how can you proceed having a relationship lakini ujikinge? Sawa. So we are not saying that after umepima unaona kuna ugonjwa you stop hapana. It just informs you kwamba your girlfriend mwenye umependa ama your boyfriend mwenye umependa ako infected. So how you go on now is your own decision. So that is not that you stop. It's not that you stop. Okay. 10. So surely we have to stop. People say they enjoy these classes. I'm honored that you are enjoying my lessons. Okay. Read the notes. Read the notes. Kati itakuja after. Tutasoma next week, tusome hiyo wiki ingine, then we'll come up with a date for the cut. Okay, so after 2 weeks, 2 meetings from now, we will agree on when the cut will happen. So I'll stop sharing and I'll ask the ODEL team, they can end the class. Thank you so much. So you can leave. Yes, the cut will be online. The cut will be online. The cut will be online.